Yes, thank you, Chair. Thank you for holding this meeting, and thank you to Director Scott and Director Schaefer for coming and explaining to the public about what's going on. I just have a few questions. I know we're limited. I hope we'll be doing more of these meetings because we have a lot of questions. First, Director Scott, do our COVID-19 survival rates match those published by the CDC back in September of 2020?
What happens with the CDC documentation is they provide data that may lag from what we currently have, but what they reflect is from us. So with this surge, we're working on getting them the data that they need, but there is a consistency between what they have because it's a reflection of what we have sent them from the state level.
So the data that they provided was national data, essentially 4 different age groups, 0 to 19, 20 to 49, 50 to 69, and 70 plus, and saying what the survival rates of COVID are. I'm sure you've looked at that. Are ours much different than the national survival rates published by the CDC?
The ones that are for our state are based on our own data, and then due to varying policies across the country, certainly the Northeast region has done the best at aligning with the most effective policies. You're going to have different outcomes at a national level. So there will definitely be discrepancies between the national take versus what we're doing, mostly because we've been the best in testing. We've had a strong contact tracing, case investigation response, and a strong connection with the community. We've stayed ahead of things given our overall public health strength. So those numbers at a state level will be different from what they say as the national landscape.
So our state numbers are better than the national average in terms of COVID-19 survival rates?
Yeah, and I need to confirm the details, but given the fact that we are doing well overall, they should be.
Okay, good. I'm happy to hear that. Next question. I'm sure the Department of Health keeps year-over-year monthly mortality rates to see what the excess mortality is due to COVID. Could you provide that to the committee, 2019 versus 2020 on a month-by-month basis, total deaths?
Yes, we can work on that and get that for the committee.
Okay, thank you very much. Next, back in the spring, it was discussed that the state would create ethical standards for the apportionment of medical care. Have those standards been created?
Yes, crisis standards of care in partnership with the hospitals.
And that's essentially saying if we have limited medical infrastructure, where do we put it?
Yeah, it's exactly the scenario that we want to avoid.
Understand completely, but if we're starting to open up surge hospitals, it's something that I think we need to be cognizant of. And frankly, I think the public and the representatives need to know what those ethical standards are. Are those ethical standards made under the Department's emergency rulemaking authority?
We developed the standards in partnerships with the hospital so that it is a collaborative outcome. While we may be able to do it just on our own at the state level, we chose to take the approach, let's work on it together. So we offered some guidelines, the hospitals wrote what they thought worked well, we reviewed, shared with them, and had a unified final version of the standards together. And yes, it's something we want to make sure everyone knows about and is aware of, while doing the steps that have been shared today with all hopes of avoiding ever having to implement them, because it does mean certain people would not have access in certain situations.
Sure, and it goes right into medical ethics, really deep questions about the role of government and saying who gets care and who doesn't care. So my question is, was any public comment solicited in the making these ethical standards for the apportionment of care? Or was that just done privately between the department and the hospitals?
We did it more so in partnership with the hospitals, but were able to receive and incorporate feedback from organizations that are most familiar with the concerns, making sure that we're addressing the rights of those with disabilities, for example. And we've considered it an iterative process so that as we get feedback, particularly from key stakeholders such as that, we can update and have updated them as we needed to.
But there was no general public notice saying, hey, the executive branch is going to put policies in place to say who gets medical care and who doesn't get medical care, and we'd like the public's input. There was no solicitation of public input.
Right,
Correct.
so there wasn't an official process, but we, with the hospitals, didn't determine this who's who wins and this isn't. The standards are in place to provide the principles that should be followed. It's really the hospitals, as they unfold, that will make the decisions in those scenarios. So there isn't like a list that says you get it or you don't.
Sure, understand completely. But the hospitals developed those in concert with the department. The department certainly had a lot of influence on those policies, correct?
Mm-hmm. And wanting to ensure that it's following standards that we've known or have learned nationally. And we also worked with experts across the state and in other areas, because we really want to, while we want to avoid that scenario, we want to make sure that what's in place reflects the best practice that's possible for how to do it right.
Understand, and I would respectfully submit that the best practice when we're dealing with these types of medical ethics issues is one that when we do, hopefully we never have to, but if we do have to implement these rules about who gets care and who doesn't get care, we can look back and say, this process was proper, the public had a role in it. I'm sure there's people out there who maybe didn't have a role, who would like to have had a role in the development of these life or death policies. And so this segues me into my next and final question for this time at that. Under the Administrative Procedures Act, the department can issue regulations for up to 180 days, emergency regulations, and that is during an emergency. They're emergency regulations. Now, the governor has purported through executive order to eliminate the requirement that those emergency regulations only last for 180 days, essentially giving them an indeterminate applicability to regulating many aspects of Rhode Islanders' lives. As you know, typically under the Administrative Procedures Act, you must seek public comment before the establishment of any regulations. Does the department intend at any time to solicit public comment for its regulatory body that is being created during this COVID crisis?
For any regulations that are being done through this crisis, you're asking?
Yes, well, has public comment been sought pursuant to the Administrative Procedures Act since the state of emergency was declared?
So there have been a handful of emergency regulations that have been done. And where we are able to do the more extensive process, even as a part of that, we really value that role and incorporate it. We always want to make sure that the opportunity to provide input is available. So I can look back at the handful of emergency regulations and get back to you on how we were able to incorporate the public's input into that process and what our thinking is for going forward beyond the emergency regulation timeframe.
And lastly, so it's one thing to say some members of the public commented. It's another thing to say that the statutory requirements of the Administrative Procedures Act, publication, notice, et cetera, were complied with. To your knowledge, were those statutory prerequisites complied with for any of the emergency regulations? I'm sure the public might have had some input, but were the statutory requirements of notice, opportunity to comment complied with for any of the emergency regulations?
Yeah, I definitely credit our regulations team that follow the steps that are required in association with emergency regulations. So I would confidently say that what's needed for the emergency regulations from a statutory standpoint was followed. But as I said, our team can go back and review what handful of regulations we have done and be able to share how that played out and what our plan is for going forward.
Okay, thank you. And thank you very much, Director. And just in closing, just because you can doesn't mean you should. And one of the things that we've been continuously hearing from our constituents is that the proper structures of government haven't been respected. And because they haven't been respected, people are kind of losing buy-in during this crisis. So I would just urge you as you go forward to follow the statutory mandates, to have the public have a role in crafting these regulations, because it'll make the public have buy-in. I feel that people are losing buy-in. They're losing buy-in for what we just spoke about. They were losing buy-in because the General Assembly failed to do its job for 8 months. And I'm happy we're doing it now. I think it's going to hearten the public that the proper structures of government are being respected. But for a long time, they haven't been. And people need to feel like they are in order to see these government dictates as legitimate. And I feel we're losing some of that legitimacy, and we got to get it back. Thank you.